First of all, I am thankful to the organizers for giving this opportunity to share my experience of treating different cases, with especially today about Rakta Mokshana. And at first I beg a pardon, all of you and organizers also. Actually, I should have come on Friday by Vamana Virechana Basti, then Rakta Mokshana. Because I have another engagement in Delhi, as a RAV convocation is going on Friday. That's I have to attend that. That's why I gave some trouble to them to change the date, all these things. So anyhow, I managed to come here. Otherwise, I could not have come to this session to meet you all. Very bright future young doctors of Ayurveda. I think you are bright futures of Ayurveda. So let us directly start the session. Next, please. First, let us pray God. Om Namo Bhagavate Vasudevaya Dhanvantaraye Amrita Kalasha Hastaya Sarvamaya Nashanaya Trilokyanathaya Vishnave Swaha. Next, please. So, next. Then let us have blessings of all Gurus. Guru Brahma, Guru Vishnu, Guru Deva Maheshwara, Guru Sakshat Tasmai, Shri Gurave Namaha. With the blessings of all our Purva Vidyas and Apurva Vidyas, with their blessings, I will start this session. Next, please. About Rakta Mokshana. First, I will tell some textual things. Let us see. You see, there are 5 types of Rakta Mokshana, you all know. Sira, Shringa, Alabu, Jalavaka and Prachanna. For each Rakta Mokshana, there is a definite indications when you have to do. So, Shringa should be done in Vata Dosha, Dushita Rakta, Alabu in Kapha Dushita, Jalavaka in Pitta Dushita, and Prachanna for Gratita Rakta, Sira Sarvanga Shodhini. And another indication is there. Tvak Rakta Mamsagata, then you have to do Shringa, Alabu, Jalavaka according to dosha. If it is Sandhi Asti Marmagata, then any dosha you have to do Jalavaka in Ekadoshaja, Ekadeshaja. Any dosha. Your Shringa, Alabu does not work there. So, Gambhire, Jalavaka. And if a area is more than Hasta Matra, then you have to go for Siravadhana. Gratita Rakta, a clotted blood is there, coagulated blood, then Prachanna should be done. Gratita Rakte, Prachanna. This is the basic indication. So you have to adopt according to presentation of the patient. So you have to diagnose the patient, which dosha, doshita Rakta, vyadhi is there, like that you have to select a definite treatment. Next, please. Next. So then first comes when you should not do the Rakta Mokshana. First we should know as a surgeon when we should not do the cut. When you should not cut, that should be known by every surgeon first. Then after only you should start to cut. So these are the contraindications. Sarvanga Shopa, Kshinasya, Amla Bhoja Nimitta, Pandu Rogi, Arshasa, Udari, Shoshi, Garbini, Shayatavaha. Shopa, the same thing he has explained. In these conditions, you should not do Rakta Mokshana. Then still, even these conditions also, if it is a Visha Jantu, the bite is there, then you can do Rakta Mokshana at that time itself, as a Atyayika Chikitsa. Next, please. Then another contrary, he says Bala, Sthavira, Kshinadatu, all these things, and Kruta Panchakarma, those who have undergone Panchakarma, Vamana Virechana, etc. But without Samsarjana Krama, then you should not. After Samsarjana Krama, you can do the Rakta Mokshana. Snehapita, after Snehapana, without Svedana, you should not do. But after Snehapana, if you do Svedana Karma, then you can do the Rakta Mokshana. Next, please. No, previous one, 1 minute. And another thing is, wherever Vidhana should be done, Avyadhyaha and Vyadhyaschapi Adrishtaha. Even if it is a Vedya, you can do it. When Adrishta, you can't see the vein, then you should not do. Drishtapi, even though you see the Sira, ayantrita, without yantrana, you should not. These are the things. And even after yantrita, if it is anuttita, if uttita Sira is not there, then also you should not do. There is a chances of injury to the patient. To avoid the injury, that's what he is saying, when we should not do. Next, please. So, next, same. So, Atyushna, Svinna, all these things. Next, please, same I explained. Then instruments, next, please. Kutarika, Vrihimuka, Ara, Veta Sapatran, Vedane, Suchicha. Usually, I use the Vrihimuka Shastra for the Vedana Karma. Next, please. Indications, when we should do. Next, please. When we should do. You see, in Charaka, one sentence is there in Vidishoniti Adhyaya. After Snehana, Svedana, all these things, Rukshana, Snehana, Chikitsa, if you don't get result, then you think it is an Raktaja Vedi, and then you do the Raktamokshana. This is actually, scientifically it is not correct. Scientifically means, when patient comes to you first itself, then you have to diagnose. Is it patient right for Sirai Vedana or not? In this statement, after doing all this, ये नहीं होता वो करेंगे, ऐसे नहीं होता है. A clinician could not do like that. That's a trial and error हो गया. This is, he said, at the end of, after frustration, if you patient again come, you do. That is what he says. Actually speaking, trial and error is not a scientific treatment. You should diagnose at first itself. It is a Raktaja, you should do Raktamokshana. That's what he says. Then, what Sushruta says, Kurya Shonita Rogeshu, Raktapati Hirim Kriyam, Virekam Upavasam, Shonitasya Mokshanam. Wherever Raktaja Vadi is there, you have to do Raktamokshana. This is the indicated treatment indicated for Raktamokshana. Next, please. Next. Then comes this famous sloka of Sushruta. What he says, you see, it's a very interesting thing. This is not Raktaja Vedis. This we have this. Gridrasi, Vishwachi, Kroshtuka Shira, Kanja, Pangala, Vatanga, Padada, Padarsha, Avabhaka, Badiriya, Damaniga Vatrogeshu, Ethoktam, Shiravedam Kuryat, Anyatra Avabhaka, except Avabhaka. In all these conditions, you have to do Raktamokshana. This question arises now to all of you. Any scientific person will have this question. What is that? These are Vata Vedis. If you do Raktamokshana, Dhatu Akshayakar, Vata Ruddhyakars. How you are doing Raktamokshana in these conditions? What answer you got?
There are two types of Vata, there is Upastambhit and Nirupastambhit. In obstructive type of Vata Vedis, we can...
Which obstructive?
The Vata which get obstructed due to the Kapha. For example,
In Kapha Avrata, you can do Raktamokshana?
no sir, just I am saying. And second aspect, that is Vidrasi, that is where is the involvement of Sira, Kandara, such like Upadhatu of the Rakta in such condition.
No, it is not scientific statement. Okay. Your assumption is okay, but actually, when we should do the Raktamokshana, what he says, Gridrasya Vatava Chigitsite Krite Paschat Shonitavarnam Nischitya. These diseases, if it occurs due to Shonita Avarana Vata Prakopa, then only you do Raktamokshana. Na Anyatra. If it is Raktavrata, then only you have to do. Not Kaphavrata or Pittavrata or Mamsavrata, Medavrata. If you take a statement of Upastambhita Vata, it becomes wrong. Scientific means Karya Karana Vivechita. Then definite understanding should be there. If it is Shonita Vrata Vata Prakopaja, Gridrasi Vishwasi, etc., you have to do Siraveda. Na Anyatra. That's what the statement he has very clearly told. So that is why you should diagnose whether the diseases, when a patient comes to you, is it a Dhatukshaya state or Raktavarana stage? You have to diagnose it. How you will diagnose? This is the question. I hope you understood. I am here to answer these questions. Okay? If I am able to answer these questions to you, I think I am successful in explaining you why Raktamokshana is done. Okay. Next, please. So, you see, in the Gridrasi itself, treatment protocol is told is Shira Basti Agni Karmascha. See, he is a physician. Still, first line of treatment he tells Siravedana. Then he tells us go for Basti Karma. Once he told like that, as we physicians, should we go first for Siravedana or Basti Karma? Eh? Which one? Siravedana you should go. Charaka himself has told. If it is Siravedana, should be first line of treatment. If you do Siravedana first, you remove Avarana, then you give Basti, you get a very fast result. Patient will get result immediately. He goes off. If even he comes in trolley, he goes walking. Even though he is horizontal, he becomes vertical. I hope you understood. It's a very fast result, immediate. That is what Charaka says. Next, please. Okay, next. Now, to understand this basic principle, Charaka says, Hetu linga vashadam jnanam swasthatara parayanam. Patients comes to us with the linga, signs and symptoms. We have to find out what is its hetu. To that hetu, we have to give aushadha. This is triad. Hetu, linga, aushadha. 3 sutra of Ayurveda. So whatever patient comes to you, they comes with all signs and symptoms. It is we Vaidyas should find out what is its hetu. To that hetu, we have to give treatment. Aushadha means a treatment. Next, please. That means on the basis of Karya Karana Vivechana, you should treat. That's what Charaka says. Even Western medicine also developed on same Siddhanta, cause and effect concept. There is no difference in this concept. In which logic you diagnose, there comes a difference between Western science and Ayurveda. In the Western science, physiology, pathology, pharmacology explained on the basis of biochemical activity of a single cell. If it is deranged, that is pathology. If it is corrected by biochemical drug, that is physiology, pharmacology. This is how Western science has developed. In Ayurveda, all the things we are explaining on the basis of Tridosha logic. That is why he says Sushruta, Nasti rogo vina dosha. There is no roga without doshas. Tasmat anuktamapi, even it is not told, doshanam linghe vyadyam charet. In uktamapi or anuktamapi, you have to see doshanam linga where in that particular vyadhi. Then give dosha vyadhi viparita chikitsa. If a patient comes with I will just explain you. You see, patient comes with different vyadhis. You are diagnosing the patient on the basis of prakrititaha, vikrititaha. In vikriti, which dosha is there? Patient may come in gridrasi. Some patient may come with the Pitta Samanvita, some patient may come with Kapha Samanvita, some patient may come with the Raktavarana, some patient come with the Dhatukshayavata Prakopa. So, Yatha Dushtena Doshena, that we have to analyze. As a physician, we should diagnose it. After diagnosing Dosha Linga, you have to see in the particular Vyadhi, then give Dosha Vyadhi Viparita Chikitsa. For example, a patient comes with the fever, Jwara. Just not giving a Jwaragna drug like that, it is not correct. In that Jwara, is it Vata Jwara, Pitta Jwara, Kapha Jwara, Didosha, Sannipata? Which dosha Jwara? Like that we have to give the treatment. Not giving same drug for everybody is not Ayurveda. Like that, in the Gridrasi, Vishwachi, etc., everywhere, you have to see dosha lingas in that particular Vyadhi, then give dosha Vyadhi Viparita Chikitsa. For Vyadhi, there will be a protocol. According to dosha, you select the drug or you select a treatment. For example, in Gridrasi, Kati Prishta Urjana Jangayoha Vedana, that is Vyadhi. Protocol is Sira Basti Agni Karmascha. It may Kapha Samanvita, then which Basti you give? Kshara Basti. If it is Pitta Samanvita, do you give Kshara Basti? You will give Kshira Basti. That is according to dosha, drug will be changed. I hope you understood. This is dosha vyadhi viparita chikitsa. So in every patient, whatever patient comes to you, first to diagnose vyadhi. Okay, then diagnose dosha in that vyadhi, then give dosha vyadhi viparita chikitsa. Then you will become a successful physician. If it is possible, it will be cured. Within 2 days he gets a result. Don't think एक महीने चाहिए बस्ती कर्म करने का 1 महीने के बाद आपको रिजल्ट मिलेगा, ऐसा नहीं है. Within 2 days you start to get the result immediately. That is what Ayurveda. Don't think Ayurveda is slow. Ayurveda is fast. Don't think it is slow. Next, please. Hetu sthana vishesha. That is why Charaka says Hetu sthana visheshat bhaved roga vishesha. Different diagnosis in Ayurveda according to Hetu Vishesha, according to Sthana Vishesha. Sthana Vishesha is Yatra Sthana Samshaya. According to Sthana Samshaya, you will have name of the Vyadhi. If it is Prakupita Vata, Sthana Samshaya at Grudrasi Sthana, you get Grudrasi Vyadhi. If it is Prakupita Vata, gets Sthana Samshaya, Tirya Gaddam and Urdu Deha, you get Pakshagata. Prakupita Vata gets Sthana Samshaya to Sandhi, you get Sandhyastigata Vata. According to Sthana Samshaya, Prakupita Vata is same. According to Sthana Samshaya, name of the Vyadhi will comes. Yatha Dosha Dushti, that is Hetu Vishesha. According to that, you will have different signs and symptoms. Hetu Vishesha, he says, Chakravani says, Pitta Avaranadi. Yatha Vata Prakopa, Pitta Avaranat, Kapha Avaranat, Rakta Avaranat, Mamsa Avaranat, Astya Avaranat, Mutra Avaranat, Vidya Avaranat, like that. Yatha Dosha Dushti. This is Hetu Vishesha. You see, same disease may have different Hetu Vishesha. Same Hetu Vishesha may have different Vyadhis. I hope you understood. This permutation combination, it should be done where? Not in textbook, in a given patient. When patient comes to you, then you have to do. Not sitting in a table and in front of a computer, you are not doing it. When patient comes to you, in live situation, then you have to do Yatha Hetu Dosha Dushti. Yatra Sthana Samshaya. Both you have to do. This is differential diagnosis you are doing according to Ayurveda. Next please. This is why Samprapti means Yatha Dushtena Doshena, Yatha Chanu Visarpata, Yatra Sthana Samshaya. This is Samprapti, you all know. Next please. So coming to this, since it is an Vata Vyadhi, Prakupita Vyadhi, Yatha Vata Prakopa occurs. That is why this is famous sloka comes in Charaka Samhita. Kruddhe Vayoh Dhatukshayat Kopo Margasya Avaranena Cha. Vata Prakopa may occur due to Dhatukshaya Vata Prakopa or Marga Avaranat. Then comes the Cha means what? Cha is their word. Both means Dhatukshaya due to Marga Avarana. Dhatukshaya due to Marga Avarana. Next please. So let us analyze it slightly. Since we are discussing about Vata Vyadhi, I have to analyze. About 5 minutes I will discuss about this concept of Dhatukshaya and Avarana. By Ruksha Shita Viruddha Ahara Viharas, Dhatukshaya occurs, Vata Prakopa, Prakupita Vata, gets Sthana Samshaya, you get a disease. This is one way. Next please. Avaranath, Marga Avaranat. Marga Avarana means by what? Kapha, Pitta, Rakta, Mamsa, Meda, Asti, Majja, Shukra, Vitta, Mutra, Anna. Here, very interesting thing is, Kapha Pitta Avarana means it is in molecular level, atomic level. Kapha Pitta Avarta Vyadhi, Sarvadahika Vyadhis, like Madhumeha. You can't have one hand Madhumeha and no Madhumeha, it is not possible. It is a Sarvadahika Vyadhi. I hope you understood. Whereas, Rakta Avarana, Mamsa Avarana, Meda Avarana, these Vyadhis, Ekadeshaja, wherever occurs. It's a Rakta Avarana is a Runashot, it can occur anywhere, Mandala Anishoyatu, anywhere in body it can occur. Mamsa Avarana is Katina Pidaka, like Arbuda, etc. Anywhere in the body occurs. Ekadeshaja. Whereas Vitta Avrata, Mutra Avrata, Anna Avrata is macro level. One is macro level, and one is tissue level or cellular level. Third one is atomic level. 3 types of Avarana is there. I hope you understood. 3 types are there. Avarana. That is what he says. Next please. Like this Prakupita Vata gets Sthana Samshaya, Amashayagata, Pakva, Sandhigata, Koshtagata, Tvaggata, etc. Gata Vyadhis, he has explained, Charaka has explained. All these possibilities are there. Ete, what he says, Ete, after explaining many Vata Vyadhis, at the end this sloka comes. All these Vyadhis, Vata Prakopa may occur due to Dhatukshaya or Margavarana. Margavarana, these are the possibilities are there. In a given patient, you have to analyze how Margavarana has happened, why it has happened, then you should adopt treatment. Avaranahara Chikitsa or Brahmana Chikitsa, you have to see. Next please, next is Cha. Initially, Avarana symptoms are more, Dhatukshaya symptoms are less. As time passed on, if you don't treat, what happens? Slowly, next please, next. Avarana symptom comes down, Dhatukshaya symptoms takes over. I hope, have you understood this statement? So for example, if a Pakshagata or Grudrasi, initially they come with severe pain or loss of hand movement, all these things, right? There is no Dhatukshaya at all. After 6 months, if he comes, all muscles are degenerated. Why it has happened? Due to Avarana, this Dhatukshaya has happened. That is Cha. So if it happens like this, if a patient comes to you, he may come with 90% Avarana, 10% Dhatukshaya. He may come with 50% Avarana, 50% Dhatukshaya. He may come with 20% Avarana, 80% Dhatukshaya. Can you give same treatment for everybody? If it is Avarana state, you have to give Karshana Chikitsa. If it is Dhatukshaya state, you have to give Brahmana Chikitsa. It may be Grudrasi or Pakshagata, anything. So, same treatment cannot be adapted in each and every day. When he comes in which state, that is why Charaka says, Avastha Vashena Chikitsam Kuryat. Which avastha he comes. That is the role of physician. Otherwise, you physicians is not needed. Your therapist will know what treatment should be given. He will do all Abhyanga Sweda, everything he will do. Why you are there? To diagnose, is it Dhatukshaya or Avarana? If it is Avarana, percentage of Avarana and Dhatukshaya. So Karshana should be done, Brahmana should be done. If it is Avarana, by what? Which type of Karshana should be done? Pittahara or Kafahara or Raktahara? Which? That is why you are there, to plan the treatment. You are planning persons. That therapists are doing the things, but you should plan. These things should be done. That is why you are there. That is why without doing this planning, treatment will not be successful. It is all mathematical equations. Ayurveda is just like a mathematics. Just you are doing assumption and doing the treatment. Next, please. Then comes, he says, different signs and symptoms. If Pitta Avarana is there, Da, Santapa, Murcha, Shula is Vata symptom, all Pitta symptom. If Kapha Avarana, Shaitya Shota Gurutvani, along with that, Shula will be there in a Kapha Avarana. Okay, when Rakta Avarana is there, there two are Sarvadhika Vyadis. But Grudrasi, Vishwachi, etc., all Ekadeshaja Vyadis, then you have to see what happens. These are conditions of Rakta Avarana. You see, Raktavrite, there will be Daha, burning sensation, Arti, Shula, where Tvak Mamsa Antarayo Brisham, in between Tvak and Mamsa, Shula will be there. Kya samajh mein aa gaya? Kuch samajh mein aa gaya? Do you think any patient comes to you, tell you, my pain is in between my skin and Mamsa? Do you think anyone tells you? Then what is that condition means? Burning sensation is there, number one, burning. Raga, redness is there. Mandalani Shvayatu is there. That everything is okay. Mandalani Shvayatu is there. But pain, arthi in between, Shula in between, Tvak and Mamsa. No. Because instead of that, Sushruta used word Sparshadveshaha. Tenderness. See, these 5 signs and symptoms. Pain, redness, Mandalani Shvayatu, and tendon. This is nothing but a inflammatory swelling according to Western system of medicine. According to here, Western system and Ayurveda meets. It's the only place where it meets. So there will be Sparshadvesha, tenderness. Now it becomes, as a clinician, for me it becomes very easy. Whenever patient comes to me in my clinic, he comes with severe pain. What I do, I put my finger like this. If he tells pain, that means it is Rakta Avarana Vata. I do Rakta Mokshana, finished. Treatment is over. How simple it is. As a clinician, if a patient comes with Sparshadvesha, any disease, that indicates it occurs due to Rakta Avarana Prakopa. Before giving Abhyanga Sweda, I do Rakta Mokshana, first line of treatment. If there is no tenderness, definitely you go for Abhyanga Swada, all other things. I hope you understood. It is how simply you can diagnose. Whole textbook you see, Sushruta, Vagbhata, Charaka, everywhere, there is no other condition or any pathogenesis where you can get Sparshadvesha. Sparshadvesha occurs only due to Rakta Avarana Vata Prakopa. For any patient comes to you with the Sparshadvesha signs and symptoms, that indicates it occurs due to Rakta Avarana Vata Prakopa. It becomes very simple now. Even the Shirashula also. There also he tells where you should do. 167 conditions Sushruta has explained where you should do Rakta Mokshana. 167 conditions. Even it's all different Vata Vyadis and also Raktaja Vyadis. So, next please. Now the question is, how this Rakta Avarana or Avarana and Dhatukshaya occurs. I will explain. You see, how this Avarana, Dhatukshaya due to Avarana. How it explain? Can you understand? Have you understood? Visualized it? It can visualize like this. I will tell you. First, Dhatukshaya and Avarana I will tell. You see, you have seen all the rivers flowing. What happens in summer? Whole river becomes dry from Moola. Okay. Water filled area of river filled with what? Not sand, filled with air. Dhatukshayat Vata Prakopa. Dhatukshayat Vata Prakopa. Okay. Now water is flowing, you put a dam. Kapha, Pitta, Rakta, Mamsa, Meda, Asti, Majja, Shukra. You put a dam. Water level rises. That means moving force rises. Energy level rises. That is Avaranat Vata Prakopa. Vimarga Gaman occurs, you get a disease. Right? What happens below stream? That becomes dry. What is the cause for dry? This dam. That is why Magaranat Dhatukshaya. I hope you understood. Dhatukshaya, Margavarana, Cha Avarana Dhatukshaya. So easily it can be understood. It can visualize it in any patient. You have to diagnose all these things before giving a treatment. Karshan or Brahmana Chikitsa. According to which dosha avarana is there, like that you have to do. Right. Then coming to Raktavarana, here one twist is there. Because all others are stable entities. Vayu and Rakta, both moving entities in the body. One is Vayu and one is Rakta. Both are moving. How one moving entity can block another moving entity? This question arises or not?
Water and air in a pipe like.
वो कैसे ब्लॉक होता है वो देखना चाहिए. We should visualize it. It can be visualized by a traffic. You see, Vayu is Sukshma, Rakta is Stula when compared to Vayu and Rakta. Right? Vayu is Sukshma and Chala, Rakta is Hara and Drava. If you compare Vayu and Rakta, Rakta is Stula, Vayu is Sukshma. Both are moving. Just like in a traffic, in the road, heavy vehicles, lorry, bus, bike, scooters. Bike, scooter is Vayu, small. Heavy vehicles, lorry, bus, both are moving. Anywhere a Rakta is damaged, that's one lorry is damaged, or road is damaged, or Rakta Srotas is damaged. Then the bike, scooter comes, lorry comes. First lorry stops. Still you negotiate your bike. After some time, 3-4 bus lorry comes, then your bike also will not go. Right? First Rakta stops, then Rakta itself blocks the movement of Vayu. Rakta Avarana Vata Prakopa. Accumulation of vehicles. Mandalani Shayathu. Heat exchange between drivers. Daha. Redness in eyes of drivers. Raga. Loss of function. Pain. Right? Immediately if you remove that Avarana, blockage is removed, it becomes all right. If you don't remove it, what happens? From traffic jam, information goes to city center. In body, city center is hypothalamus. In turn, whole city temperature increases. Whole body temperature, Santapa occurs. First Runa occurs, then from that Santapa occurs. This is how Avaranat, these all diseases will occur further. Jwara, all this, anything can occur. So, initially in that state itself, if you remove this avarana, it will become all right. Otherwise, there is chance of dhatukshaya or santapa or other diseases can occur. So, next please. So, to this happen, there should be rakta dushti. Lori dushti, rakta dushti should be there. In Vidishoniti Adhyaya, he has clearly told many causes of rakta dushti. Here one question again arises. What is that? Rakta is a dhatu. Vayu is a dosha. Vayu is Shakti Swarupi Dravya, whereas Rakta is a Shakti Yukta Dravya. Its Shakti is given by doshas only. How this Shakti Hina Dravya dhatu can block the movement of Vayu, Shakti Swarupi Dravya? वो उसको फोड़ के निकाल जा सकते हैं ना? How it is possible? This question definitely arises. That is why Rakta cannot block a Vayu by itself. Rakta should be dushita by doshas only, by ahara vihara. According to Vata Swarupa, Kapha Swarupa, Rakta Dushti should occur. This Dushita Rakta can only block a movement of Vayu. So that is why you see in the Vidishavani Adhyaya, first line you see, Pradushta Tikshna Adhya Tilavakshana Katubirevacha, Pitta Swarupa Rakta Dushti Karana. Alcohol drinking, smoking, Kshara, Lavana, Katu, all these things you see, patient comes with the stroke, midnight. Rakta Dushti, Rakta Pitta Swarup Rakta Dushti. Second and line is Kapha Swarup Rakta Dushti Karana. Kulattam Nishma Pinda Almar Haritan Sarvasha Jalacha Daddi Amlam Suktan Sura Savya. All Kapha Swarup Rakta Dushti Karana. Sixth line is Vata Swarup Rakta Dushti Karana. Chaddi Vega Prativanga Kale Janavasechanat Vata Swarup Rakta Dushti Karana. One is Vata Swarup Rakta Dushti. Second one Pitta Swarupa. Third one Kapha Swarup Rakta Dushti. Or mixed causes Vata Kapha, Vata Pitta, Kapha Pitta, or Sannipat Swarup Rakta Dushti, Raktarano, Vata Prokopa. This is Ahara Viharas. Second cause is Abhigata. Abhigata is injury. If a road traffic accident, injury occurs, patient comes with the stroke. Raktarano, Vata Prokopa. Or Bhagna occurs. Rakta, patient comes with the swelling, pain, all these things. How? Abhigata is a cause. One is Abhigata, second one is Ahara Viharas. Is there any other cause for Rakta Dushti? Next please. Next. You see? Raktadishtan Prayan Vikaran Janayantite. Raktaja krimis. Pushta Visarpa Pida Kadin. All infections. All infections. Maybe virus, bacteria, fungus, any infections. Anything can cause Rakta Dushti, Rakta Varana, Vata Prakopa. This Prakovitavad gets on. Otherwise, how you will explain a pot spine causing the Grudrasi? Krimi Rakta Dushti, Rakta Varana, Prakopa, leading to this one. Or transverse myelitis. Patient comes with the Pangu. It's all because of krimi it occurs. One is krimi, Abhigata. Third one is Ahara Vihara. Like rheumatism comes with severe pain or this. It's all Ahara Viharat. All three causes are there. Previous one. By this, there are many diseases. Santapaschadurbhyam, Sirasascha. You see, Santapaschadurbhyam, Aruchi, Sirasascha. All COVID symptoms. You see. Krimi is Rakta Dushti. Anything can happen. Or Ahara Vihara. It can happen. Right. Next, please. Next. So, as it is clear now, Rakta or Vata Prakopa leads to Pranashota, which can occur anywhere in the body. Tvak, Rakta, Tvak, Mamsa, Sira, Snayu, Sandhyasti, Marma, Koshtha. In the Gridrasi Snayu is involved. Or Sira Granthi, Sira involved. Sandhyasti Gavata, Sandhi involved. Or in the Pakshagata, Marma is involved. That is why Sushruta used Dosha Bhigataja, Marmaja Pakshagata. Dosha Bhigataja in Marma. Shiro Marma is involved. Marma is a sthana. There, any sthana can happen. This is Sushruta he has explained. So, it's called Rakta Dushti Vikaras according to Sthana Samshaya. While treating such cases, if it is Abhigata, Chikitsa is Shalya Chikitsa. If it is Ahara Vihara, Dosha, Amapachana. If it is krimi, what should be your treatment? Krimi Chikitsa. What is krimi Chikitsa? Apakarshana means? Panchakarmas. That comes under Apakarshana Chikitsa. Nidana Parivarjana. Prakriti Vighata. Prakriti Vighata means? मेरा प्रकृति है उसको विघात कर्म मीन्स किलिंग ऑफ द क्रिमी बिफोर एडवांसमेंट ऑफ माइक्रोस्कोप इट इज डन बाय अनुमान प्रमाण आफ्टर एडवांसमेंट ऑफ माइक्रोस्कोप you find out which krimi is involved. Then Western medicine, they have developed many drugs which can kill the krimi. That is how antibiotic developed. It is actually Sushruta's concept. Hetu Viruddha Chikitsa. In Ayurveda, many drugs are told. Next, please. You see, Surasadigana, Saptakarna, Karanja, Nimbara, Tvaja, Gomutra, Shekaha, and Ksharodaka. These are all krimi prakriti vigata dravyas. Ksharodaka you are all using daily. You are using or not? Daily. You are not using daily. You are using soap or not? That is a क्षारोदक. आप इंग्लिश में कहते हैं तो एलोपैथी, संस्कृत में कहते हैं तो आयुर्वेद है, हैं? रवि शंकर है तो आयुर्वेद, सन शंकर है तो एलोपैथी. द्रव्य तो एक ही है. I hope you understood. Our mindset we should change. We should not think, oh, English में बताया सब एलोपैथी. ऐसे नहीं. What is concept? You understand, right? So you can understand any herbal or mineral or any drug which can kill the krimi. It is nothing but krimi prakriti vigha chikitsa. Ayurveda concept. That's all. Next, please. So, if infection theory is that much, why Sushruta has not told in first chapter itself? He told in 56th chapter in Uttara Tantra. Why? What is the cause of disease then? Krimi or dosha vaishamya? You see, I am having crores of bacteria on my body. I don't get any disease. Why? Because I am in samadosha avastha. If by ahara vihara or abhigata dosha vaishamya occurs, then only krimi can cause a disease. Otherwise, krimi will not do anything. That is why in Ayurveda, as a mathematical equation, they are saying krimi is not the cause of disease. Dosha vaishamya is the cause of disease. If krimi once invaded, unless you remove the krimi, how much ama pachana you do any panchakarmas, you will not get any result. I hope you understood. So, always, once the krimi invaded, you have to try to remove it. If it is a milder this one variety, then you can go for ama pachana chikitsa, because body can fight it out. Otherwise, you have to do krimi prakriti vigha chikitsa. This is why when Western medicine is developing, because they have adopted it. They have done krimi prakriti vigha chikitsa and ama stambhana they have done. What we are doing? Krimi prakriti vighata and ama pachana chikitsa is Ayurveda treatment. That's why we are treating. Next, please. Next. So here coming to, I will take for Sira Basti Agni Karmascha, Gridrasi concept I will take and I will show how it is being treated. Because there are many diseases, I will take only Gridrasi, because like that all other Raktavarana Vata Vyadhis occurs. So rumors degenerative, sciatica means there will be injury, abhigata will be there. Just you sneeze, there will be disc prolapse, injury, abhigata, rakta dushti, raktavarana vata prakopa. This is how Gridrasi occurs. Sirasana, Kati Urjana Janga with radiating pain occurs. And brachial radiculopathy in the hand, that is Vishwachi, it occurs. Next, please. Cervical disc collapse. So you see what he says, Prashna Pratyangalam Kandara Yanardita Sakti Ukshepam Nigrinnati. SLR test is positive. Sakti Ukshepam Nigrinnati. This is sign of a Gridrasi. Next, please. Like that, Tala Prakrina Pangandara Bahu Prushtata Bahu Karma Kshayakari Vishwachi. Vishwachi means Yatha Gridrasi Sadrisha Bahu Gatanam. Yatha Gridrasi in leg, Tata Vishwachi in hand. Tala Prakrina, like this radiating pain occurs in hand, then it is known as Vishwachi. If it is leg, it occurs in legs, it is known as Gridrasi. Okay. Next, please. So then comes Gridrasi Vishwachyoh Pratipadameva Kali Samjna. What Harita says? Gridrasi Vishwachyoh Pratipadameva Kali Samjna. Kali means Tivra Ujanvita Bahu Amotini. You bend one side. That is known as Kali. He says this Kali is nothing but Pratipada of Gridrasi. Pratipada means? Pratipada means kya hai? No. You see, 15 Tithi is there. Pratama, Dvitiya, Tritiya, like that. No, Pratibhada means first. Second is Gridrasi. That means Gridrasi's first stage is Kali. Pratibhada meva. So, if you see the previous state of Gridrasi is Kali. If you see what happens, in a disc, slight prolapse is there. There is a severe irritation of the nerve. Patient will have severe pain. That is why you do bend one side. Scoliotic changes occurs. That is a Kali state. First state. Patient will come with crying, with severe pain. right? Still more disc prolapse, pain will comes down, but Sakti Ukshepa Nigrinati will be there. Still it moves forward, what happens? Paraplegia will be there. That is nothing but next please. Vayo Katna Sakta Kandarakshipet Kanjasthabaja Pangu Stakno. That is known as Pangu. That is third stage. First stage is Kalli, second stage is Gridrasi, third stage is Khanja is one leg, both hand leg is Pangu. Kalli is one hand severe. Next stage is Vishwachi. Khanja, both hand, that is a Pangu. Same disease, 3 stage. Kalli, Gadrasi, Pangu. Same disease. In the Pangu state, patient will not have pain, only loss of the function. So what happens as a clinician I have seen, patient comes with the crying, severe pain, physician is always happy because easy to cure. If a patient comes happily because of loss of both leg, physician should cry. It is very difficult to cure. You can't do anything. This is the vice versa. So whether you are crying or patient is crying, that decides prognosis. Next, please. So you see, this is how disc prolapse. Don't think Gridrasi occurs only due to disc prolapse. Even a osteophytes changes occurs in the bone, that also irritates the nerve. There will be severe sciatic pain. That's very difficult to cure. Next, please. Or this also can be Gridrasi. Next, please. Just a slight your diagnostic for Gridrasi is nothing but MRI scanning. Now, previously we are doing all clinical exams. Now, just you do MRI scanning, you can diagnose. Is it due to disc prolapse? Is it due to pot spine tuberculosis? Is there any growth? Everything can be diagnosed. Next, please. Even this much disc prolapse, that also can be cured. How patient presents you. If it is complete paraplegia, it's very difficult. If asphyxia is there, complete closure of the all stenosis is there, then you have to go for surgery. Otherwise, you can cure with our Ayurveda treatment. Next, please. Vata Kantaka, again, it is a Vata Rakta, this one, calcaneal spur or fasciitis. It is again Rakta Varna Vata condition. You do the Rakta Mokshana. Gambira, if it is superficial, go for Shringalabu, etc. If it is Gambira, Sandhi Astigata, what all this, go for Jalauka is a first line of treatment. Next, please. Padadaha, when the patient comes with burning, Gridrasi with the burning, that is Pitta Samsarga Vata. If it is Pada Harsha, that is Kapha Samsarga Vata. Next, please. Pada Harsha. That is numbness, Supti, etc. is there. Next, please. So, with all these understandings, if a patient comes with all these signs and symptoms, when you treatment protocol you decide, what you do, if it is a Kevala Vata or Pitta Samsarga, Kapha Samsarga, what treatment you first adopt? If a patient comes with Pitta Vata, first Pitta should be treated, then Vata. If Kapha Vata, first Kapha should be treated, then Vata. If Pitta, Kapha, Vata, all three is involved, first Pitta should be treated, then Kapha, then Vata. So, since it is a Raktavarana condition, that is why Charaka says first line of treatment is Sira Vyadhana. It's next, please. That is why Sira Basti Agnikarmascha. Now, let us see how this Sira Vyadha should be done. Next, please. Next, please. Now you understood instrument. Next, please. Next, again. Method, how it should be done. Next, please. Purvakarma. Next. What Purvakarma should be done? Snigdha Swinnam Aturam Yathodam Pratyan Tarava Praya Siddham. Snigdha Swinnam Aturam. Snigdha Swinnam means Snehana Svedana should be done. Samyak Sneha. You do Snehapana for 3 days, 5 days, 7 days. Then you do Svedana. Then you do Rakta Mokshana. Now here one question arises. Many of them ask me, what they ask, after Snehana Svedana, dosha comes to Kosta, how you are doing Rakta Mokshana? This question arises. Right? Now my question is, when dosha comes to Kosta? After Snehana Svedana, dosha comes to Kosta?
औषध आप देते बाद में
आफ्टर वमन देने के बाद आते हैं, वमन द्रव्य देने के बाद स्वेदन आता है, उसका मतलब है दोष इज कमिंग टू कोष्ठा. स्नेहन डस दोष उक्लेशना, स्वेदन कम्स स्रोतो मुख विशोधना फॉर द पर्पस ऑफ दोष कमिंग टू कोष्ठा, बट दोष डस नॉट कम. दोष when comes after giving vamana dravya, lalata svedana occurs, that means dosha coming to kosta. That means before that dosha will not come to kosta. What he says in the rakta mokshana, instead of giving vamana dravya, you give prabhuta drava snigdha yavagu. उससे क्या होता है, इंस्टेड ऑफ दोष कमिंग टू कोष्टा, दोष कम्स टू रक्त along with the द्रव स्निग्ध यवाग. मुहूर्त, दैट्स यू हैव टू वेट फॉर मुहूर्त काला. मुहूर्त काला you wait, then you do शिराव्यधना, श्रावेत धारया along with the दूषित रक्त. This is what he says here. Dallan again, he explains it again. Why you are giving द्रव स्निग्ध यवागु प्रभूत मात्रा. After Svedana, all these things, you do Prabhuta Mantra Dravasnigayavagu whenever you want to do the Rakta Mokshana. Wait for Muhurta Kala. Then dosha, instead of going to Kosta, come to Rakta. Then you do Vyadhana Karma. Rakta comes out. Along with the Dushita Rakta comes out. Next, please. So, here you are doing Snehana. When you have to do Snehana? Sir, I think morning he has explained very nicely. When you do Snehana, for Mamsala, Medura, Bhurishleshma, Vishamagni, in these patients you have to do Rukshana Karma. What are the Rukshana Karmas? क्या है? देखो, Rukshana Karma means all Langana comes under Rukshanas. What are Langanas? There are 4 Shodhana Langas, 6 Shamana Langa, Deepana, Pachana, Dwarta, all these things. What about Shodhana Langana? Vamana, Virechana, Nirobhasti, Raktamokshana. Can we done it? For Vamana you have to do Snehana. For Snehana you have to do Vamana. Which is first? Ande pehle, Murgi pehle. That is why Charaka says, Avastha Vashena Chikisam Kuriyat. Already dosha uklesha is there in a patient. Why you need Snehana, all these things? You do Vamana directly. Sadhya Vamana or Sadhya Virechana. That is what he says. You do Sadhya Sadhya Virechana, you get Deepta Agni, then start Snehana. Already dosha uklesha is there. If uklesha is not there, if Medura Purusha is not there, Agni Vishama is not there, Agni is all right, then you only Shamana Langana is sufficient, you do it. But otherwise, you do this one first. So this Rakta Mokshana can be done as Sadhya Rakta Mokshana also can be done. Sadhya Basti also can be done. This is according, this is a physician's domain. You are thinking should be done on, because if a patient comes with severe pain to you, वो तो लाइटे आए हैं व्हील चेयर में, आप उसको स्नेह माने करते करते 5 दिन रहेगा तो रुकेगा क्या? वो भाग जाएगा, भागेगा नहीं है, वो तो रुकेगा नहीं है. ऐसे पेशेंट दोष उक्लेश है, you do Sira Veda, immediately patient starts walking. This is what he says. When dosha uklesha is there, when severe pain is, that means dosha uklesha is there. He will not stay in your clinic, he will run away. आप किए क्या कर रहे हैं? हमें इधर पे आप इधर फिर स्नेह दे रहे हैं, क्या कर रहे हैं मुझे बताएगा, कोई नहीं रुकेगा आपको क्लिनिक में. ठीक है. This is the conditions. According to condition, you have to select the treatment. You do Sadhya Rakta Mokshana, Sadhya Vamana, Sadhya Virechana. You do immediately, patient gets relief. Then you can do Basti Karma, whatever needed, you do afterwards. Next, please. Next. That is next. Next. That is why Apatarpana means Apatarpana Sarva Langanam. Next, please. Next. Sa samrambheshu, Vagbhata says, Sa samrambheshu kartavyam urdhvam adhascha shodhanam. Sa samrambha means acute state is there. Then urdhva adhash shodhana karo. Urdhva adhash shodhana means आप स्नेह मन करते करते रहेगा तो भाग जाएगा. That is why he says immediately you can do it. Next, please. Upavaso. Next. Then coming to actual procedure. Next. You see, what you have to do, Samyak Snigdha, Samyak Sweda, Drava wait for Muhurta Kala, 48 minutes. Then you are doing actual procedure. What is the Purakarma? These are Purakarma you do. Next, please. Now let us do, see, Samyak Abhyanga and Sweda is done. Okay. Next, please. This already you have, no. Next, please. It is Sarvanga Sweda. Next. Sarvanga Abhyanga, Sweda is over. Next, please. Then Pradhana Karma. In Pradhana Karma, what you have to do? Next, please. Next, I will explain it. Next. You see, Mamsa Vabreshu, in a clear sky should be there, all these things. When acute state, if a patient comes in a rainy season, tell him you come in winter season when there is no cloud, then you do. No, that is why I am saying. In that state, you have to do immediately. Hatyeka. Okay. Yeah. Next, please. So, next, again, I will explain all these things. Samyak Gatva, first Dushita Rakta goes, when Shuddha Rakta start come, by it stops by itself. I will show you actually these things. Next, please. First, Sthanika Abhyanga and Sweda should be done. In the Pradhana Karma, now after all this Purva Karma is over, when patient comes to table, OT table, you do Sthanika Abhyanga and Sweda, where you are doing the Rakta Moksha in that area. Different places he has told, Sushruta has told. For Gridrasi, etc., 2 angula above Kshipra Marma. Okay, in the leg or hand. Or Khandara Gulpaya Madhya, in this area. Or 4 angula below and above knee joint. And other for head here, many places he has told. That place you have to do Raktam. In that area you do Sthanika Abhyanga and Sweda. Then Yantrana should be done. Then sitting position is always better. Tapping should be done. Uttita Sira, then Vedana should be done. I will show you the procedure now. Next, please. Sthanika Abhyanga. Next, please. This is a patient of Grudrasi. Next, please. Then Sweda, Nadi Sweda is done. Nadi Sweda is done. Next, please. Nadi Sweda is done. Next. Yeah, next, go for next. See, patient should be in sitting position. This thala should be pressed to the area. Then yantrana should be done. Yantrana means tourniquet. Tourniquet. Done. Then you get Uttita Sira. Uttita Sira you can see. Uttita Sira. Tapping should be done. I am cleaning with the spirit swab.
ಸರಿ 45 ನಿಮಿಷ ಆಯ್ತಾಗ ಮುಹೂರ್ತಕ
And take Vihimukha Shastra. See,
ತೆಗೆದ್ರಲ್ಲ ತೆಗಿತಾ ಇದ್ದೀರಲ್ಲ
its mukha is just like a Vihi. That is not Suchi, that is a Vihimukha Shastra. Suchi for Sivanartham. Vedhanartham Vihimukha. Injection needle is nothing but Vihimukha. Its mukha is just like Vihi. Have you seen? It's for Vedhanartham. 18 number. उसका अग्र अर्धा एव प्रमाण should put prick. That much you prick. You prick it अर्धा एव प्रमाण. श्रावयेत धारया रक्तम. दूषित रक्तम. अग्रे स्रवति धारया. As दूषित रक्त goes off and Shuddha Rakta start to come, it will stop by itself. Here how much Rakta should be removed, you are not deciding. Disease itself decides how much Rakta I should go out. When Shuddha Rakta starts to come, it will stop by itself. This is Vata Kapha Dushita Rakta. Shama Varna is there and Pichilata is there. Some patient comes with yellowish blood. Some patient with the Sara, severe Thanu Rakta is Vata Pitta Dushita Rakta. You can make out. In all Raktas you can make out which Dushita Rakta is there. Go for next. Go on doing next. See, when Shuddha Rakta start to come, it slows down. Next go. See, start to reduce. Next, please. See, reduced. Next, please. Next, please. Next. Stops. Next, please. Next. Yeah, it almost stops. Now we have removed. See how much rakta usually samyak shodhita lakshana. Prastha matra is highest. Prastha is 13.5 720 ml. Ardha prastha 360 ml. Ardhasya ardha prastha 180 ml. These three matra is there. Like Vamana 3, 4, 6, 8 Vegas, like that. 180 ml, 360, 720 ml. This much rakta can go. Next, please.
Yes.
Next. Go for next. Why you went to previous one? Yeah. See. It's almost 180 ml. One kidney tray is 500 ml. It's almost 180 ml. That is gone. Go for next. See, what is the result of it? Laghavam, Vedana Shantihi, Vyadehe Vega Pariksheha. This wording is very important. Vyadehe Vega Pariksheha, not Vyadhi Parikshaya. For Vyadhi Parikshaya, you have to do Basti Karma afterwards, because Vata Vyadhi. Vyadehe Vega Parikshaya, Rakta Avarana is removed. Then you have to do Vyadhi Parikshaya, you have to do Basti Karma. Sira Basti should be there. It is not fancy. For doing everyone Rakta Moksha daily you do, it is not the treatment. It is a first line of treatment. After that you have to do Basti Karma, otherwise it is a failure. Okay. If slight this Tivra Uji is there, you have to do Agni Karma. Sira, Basti, Agni Karmascha. So don't do thesis comparing Rakta Mokshana with Agni Karma, Rakta Mokshana Basti. It is a protocol. You can't compare one protocol with another protocol. Like the comparison, you can't get any result. If you want to see the effect of Rakta Mokshana, what you have to do? For 10 patients, you do Basti and Agni Karma. For another 10 patients, you do Sira, Vedana, Basti and Agni Karma. In which patients you have done Sira, Basti, Agni Karma, you get better result than only Basti and Agni. Then you see that is the result of Rakta Mokshana. That can be done. But Rakta Mokshana with the Agni Karma, Rakta Mokshana Basti, like that you can't do. Because Rakta Avarana is there, but your Rakta Mokshana is useful. If there is no Rakta Avarana, only Gridrasi, Dhatuksha is there, your Rakta Mokshana is useless. How you will compare? You can't do it. Comparison should be done. No, whole disease you have to do like that. Then you can make out. Whenever Rakta Avarana is there, then only it is useful. Like that you diagnose and give a specific treatment. Next, please. अभी में भी दिखाएंगे एक मिनट पिक्चर बाकी है
ಕಡಿಮೆ ಆಗಿದೆಲ್ಲ ಕಡಿಮೆ ಆಯ್ತು
ये देखो सेम पेशेंट का है शक्ति उत्क्षेप is there you can able to do it. And another important thing is Lago Vedana Shanti, he will be very happy. Manasascha what he says Manasascha Santosha, this things in every patient you can see. Previous one you do, yeah, you see how much happy is. Just Manasa Prasada will be there. You see how happy he is, very happy. If you see any patient you do Rakta Mokshana, after the patient feels very happiness will be there. Manas Prasada will be there in that patient. Next, please. Go for next. So this is a again next, please. Next, I will say. I have told these things. Next. Then this is in the hand. Next. You see, if it is a patient of Vishwachi, in this area I have done. Any straight vein you can take for the Rakta Mokshana. Any straight vein nearby. Not necessary when here only should be done, 2 angle above only should be done. Any straight vein you can take in the vicinity. Next, please. Next. Same thing. Next. Paschat Karma. Next. Here, if once you prick, if Rakta does not come immediately, then what you have to do? What he says, on that evening itself again you can do, or next day morning you can do, you can try the Rakta Mokshana. It's one thing. Still, you feel after Rakta Mokshana, you feel his Dushita Rakta has not gone completely. After 1 month, after doing Sneha and all these things, after 1 month again you can do the Rakta Mokshana. But once complete Rakta Mokshana has happened, you have to do another Rakta Mokshana after 6 months. Before that you can't do. That's what he told. Antara is 6 months. And this is Natyushna Shitna Lagudipanyam. Even though it is a Dushita Rakta, along with the Rakta, Agni also goes. There will be Agni Mandya happens, by that Vata Prakopa can happen. That is why as a Panchakarma you have to do Lagudipaniya Dravya. Amla Dravya, Lagudipaniya. Usually I give Madhipala Rasayana. Madhipala Rasayana I give, or Punarnava Mandura. These things I usually give to the patient. Madhipala Rasayana. Next please. Discussion. Next. So this guy I have already told. Shringa Alabu Jalauka. Shringa for Vatadushita. It removes Rakta from 10 angula area. Alabu for Kapadushita. It removes Rakta from Dvatasha angula. Jalauka for Pitta Dushita. It removes Rakta from Hastamatra area. Why Shringa is you are doing Achushana. Why you has a Chalanatmaka karma? Because forcibly you are removing it. In Alabu, Agni is you are using, that is why it is a Kafahara. That is why you are using as a Agni and Akasha. Both is against Kafa dosha. That is why you are doing Kafa Dushita Rakta. Jala Adivasa, Jalauka is there, is a Pittahara. That is why you are using Jalauka in a Pitta Dushita Rakta. And in the Gratita Rakta you are doing Prachanna. Sira, in any dosha, anywhere, you can do Sira Vedhana. That can be done. Sira Sarvanga Shodhini. Next please. So next. Okay, this is all I have told. Pindite Raktam Prachannaha. Next please. Now I think you understood why Gridrasi Vishwacha, all these things we are doing the Rakta Mokshana. Next please. Next. And previous one. Here you see Sarveshu Purvokteshu Rakta Anubandajeshu and Raktajeshu Shiravedo Videya Na Anyidrasheshu. If there is no Shonitavarana, you should not do Rakta Mokshana, even though it is an Vatavyadhi. Whenever Rakta Avarana is there, then only you should adopt. How you will understand Rakta Avarana? Tenderness. So it is easily you can diagnose and give the treatment. Then you can ask, patient comes with Bhagna, severe tenderness, can you do Rakta Mokshana? Sushruta contraindicated Rakta Mokshana in 2 conditions. One is Bhagna, another one is Pakshagata. These 2 conditions, even though it is Rakta Avarana, you should not do Rakta Mokshana. He says Rakta needed for development of Snayu, Astya. I think that may be his reasoning. I don't know why it is. He has not explained. But he has contraindicated 2 conditions where you should not do Rakta Mokshana. Even though it is Rakta Avarana, Vata Prakopa. Because you by-hearted, by splendorness you do Rakta Mokshana, then tomorrow Bhagna comes, you do Rakta Mokshana. That you should not do. Okay. Next please. So then comes Agni Karma. By default I will explain Agni Karma also. Only 5 minutes. See, Agni Karma is Ruksha Agni Karma, Snigdha Agni Karma. When Tvakka Rakta Mamsagata, you do Ruksha Agni Karma. Sira, Snayu, Sandhi, Asti, Marma, you do Snigdha Agni Karma. You see? Kshaudra Gudasneva, Sira, Sandhi, Asti, Tegate. Jambo Shitara, Mamsagatanam. Pippal Adha Shakruta, Tvakgatanam. So, Ruksha Agni Karma, Tvakka Rakta Mamsagata. Snigdha Agni Karma for Sira, Snayu, Sandhi, Asti. Next please. Then you see, he has explained Sira, Snayu, Atyugra Ruji Vayu, you do Agni Karma. Next please.
Other type of treatment is Agni Karma.
This is Snigdha Agni Karma, just you see. क्या हो गया चले गए
Other type of treatment is Agni Karma. Agni Karma means burning the tissue by heat. Here you see a person, aged person came with pain in low back. So we will show you how the Agni Karma is being done here. See, first he has to lie down, the oil has to be applied all over body. The area of the pain is first located and pinpointed. Then what I do is I keep a coin over there, the area of pain. Then we take some leaf,
You can keep any
leafy
other thing.
drugs,
Don't think coin is needed.
put some
Coin is
oil
easily available, that's
and
it.
made into heat. This hot leafy drugs has to be put over another leaf like this. Then that has to be taken like this. Then a coin is kept over that. Then what I do is I apply this hot oil with medicated leaf over the pain area. You see, there is no hot bloods also. By that, patient will get relief immediately.
ಕಡಿಮೆ ಆಯ್ತಲ್ಲ ಉಂಟ ನೋಡಿ ಕಡಿಮೆ ಆಯ್ತಾ ಕಡಿಮೆ ಆಯ್ತಾ ಆಗಿನ ಎಷ್ಟು ಉಂಟಾ ಕಡಿಮೆ ಅಲ್ಲ ಹಾಂ
If needed, again you can do that.
After the treatment, if you can see here, he is walking straight. When he came, he was bent by pain. Now he is moving around.
Again you want to see? Yes. Go for it again.
The other type of treatment is Agni Karma. Agni Karma means burning the tissue by heat. Here you see a person, aged person came with pain in low back. So we will show you how the Agni Karma is being done here. See, first he has to lie down, the oil has to be applied all over body. The area of the pain is first located and pinpointed. Then what I do is I keep a coin over there, the area of pain. Then we take some leafy drugs, put some oil and made into heat. This hot leafy drugs has to be put over another leaf
That is Dattura Patra.
like this.
You can take Arka Patra also or Kadali
Then
Patra also.
that has to be
Patra does not have significance. That hot oil has significance.
taken like this.
To
Then
protect
a
my
coin
finger,
is
oil
kept over
use
that.
or use. Otherwise my finger
Then
will burn.
what I do is I apply this hot oil with medicated leaf over the pain area. You see, there is no
That
hot
fraction of
bloods
second
also. By that, patient will get relief immediately.
ಕಡಿಮೆ ಆಯ್ತಲ್ಲ ಉಂಟ ನೋಡಿ ಕಡಿಮೆ ಆಯ್ತಾ ಕಡಿಮೆ ಆಯ್ತಾ ಆಗಿನ ಎಷ್ಟು ಉಂಟಾ ಕಡಿಮೆ ಅಲ್ಲ ಹಾಂ
After the treatment, if you can see here, he is walking straight. When he came, he was bent by pain. Now he
here
is
I am not burning. Now how it is Agni Karma? See, Agni oil boils in 165-degree temperature. That much heat oil. I am using leaves to protect my fingers. That coin also to protect my finger I am using. There is no other significance. I am putting it that fraction of second. Oils, that heat goes through Roma Kupa. It's a virya, goes inside, it burns the tissue there. Immediately you get the relief. That local Agni Mandya is relieved. Amapachana occurs immediately by that heat. Patient gets the relief. You are doing Amapachana. That is why you are doing Agni Karma. That much fast result is there. Immediately, if patient comes with bending, he becomes straight. Immediately, that relief occurs. That is why you are doing Atyugra Ruji Vayu is there, then you have to do Agni Karma. If there is no Atyugra Ruji Vayu, if you do Agni Karma, it is a waste. The patient will not get any relief. Okay. Since it is a deeper one, which one? Sthira Snayu Asti Sandhi. If Tvak Rakta Mamsa, you do Ruksha Agni Karma. Next, please. स्थानिक अभ्यास कर सकते हैं, होल बॉडी का करने की जरूरत नहीं है, स्थानिक अभ्यास कर सकते डेफिनेटली. इट कैन no coin should not be hit, otherwise everything will burn, skin will burn. That becomes ruksha agni karma. Coin hit means ruksha agni, oil should be hit.
Sir, the role of coil is just only for the support. The role of coil.
Role of coin is just support. You are not heating the coin at all.
Or which type of leaf?
Leaf with datura patra.
No, sir.
Oil.
Mixture the oil and
Tila oil and patra is datura patra. You can use arka patra or kadali patra, anything. Some material should be there. No? Just oil, just a pour nahi kar sakte. Immediately that will burn ho jaye. You can use eranda taila. You can use sarshapa taila. Any taila. Nariyal ka taila, wo bhi use kar sakte. It is nothing like that. Any oil boils in 165 degree temperature. Next, please. So here is a Ruksha Agni Karma. It's a case of tennis elbow. Tennis elbow is brachioradius tendon. It is Mamsagattavata. This is you are doing Ruksha Agni Karma. You can use Panchaloha Shalaka also. It should be red hot, that's important. It is not painful. See, she is allowing. रंगोली करने का है.
One table I want. You have been there? Shankar,
And apply Haridra Churana to that area.
Okay.
Now, why patient is not having pain? If plushta is there, severe pain occurs. Durdagda also severe pain occurs. Atidagda also severe pain occurs. But samyak dagda there is no pain. Why? Because you are burning the whole epidermis. There nerve ending also burnt. That is why you will not have pain in a samyak dagda. If you ऐसे कामते कामते प्लुष्टा और दुर्दग्ध किया पेन हो जाएगा. सम्यक दग्ध करेगा तो देयर इज नो पेन विल नॉट अकर. सो यू शुड डू सम्यक दग्ध.
कुछ पेशेंट में सर पेन तो होता ही
नहीं, आप करेक्ट उतना एपिडर्मिस बर्न होता है तो पेन नहीं होता है. इफ पेशेंट हैज अत्युग्र रुजि वायु देन ओनली. इफ ए नॉर्मल पर्सन का करेगा तो पेन वो फील करेगा.
Sir, how we can assess the depth of that particular person?
That comes by practice. दैट कम्स बाय प्रैक्टिस. कुछ लोगों का बंद करो तब प्रैक्टिस हो जाएगा. Okay, next please. So then comes Basti Karma. I think sir will tell after 2-3 days. Just I will send one sentence, I will finish. First, Sadhyomana Devrechana Langana Karma you do. Then get Deepta Agni. Then for Basti Karma, for Anuvasana, Kapha Ama is there. Bruha Saindavita illa, Pitta Vata, Kshira Balata illa. Asti Dasu Kshaya hai to Tikta ka Sarpi Basti. For Niruha, Kapha Ama hai to Kshara Basti. Pitta Vata hai to Kshira Kashaya Basti. Dhatu Kshaya Vata Rudya to Tikta ka Sarpi Kashaya Basti. Next please. So internally use Amapachan, Rakta Mokshana, these all these things. Then comes Guggulus, all these things. Then comes, if patient comes very severe, Dimbasta, Stavirastha, pregnant woman, old age, small baby, Vata Pitta, Ativisrata, severe Vata Ativisrata, status asthmaticus hai, status epilepticus hai, or severe temperature, Pitta Ativisrata, severe loose motion hai, Amopi Stambaniya, Pajanad Marana Bhayat. That condition you have to do Amastambha. All modern medicines are nothing but Amastambhakas. Receptor blockers or protein inhibitors. This all modern medicine concept is Amastambhana. Symptomatically reduce the symptoms. Hoyatu Virudha is only antibiotic. All other are Amastambhakas. Next please. So here one patient, next please. Patient came with severe pain. After treatment scoliosis is there. Next please. Next. Yeah, same person. Next please. You see, after all treatment, you see his spine comes straight. You see, police officer that he is doing march first. You see. Whole his spine becomes straight and becomes all right. So, Sira, Bhakti, Agni Karma is done. Next please.
Sir, duration of the treatment?
4 months. For this patient took 4 months. Some patient by 21 days, 12 days, or 12 days, so Basti Karma everything finished. After that he should take Shaman Aushadhi for 3 to 4 months. Then patient becomes all right. So Satata Adhyanam, Vadaha, Paratantra Avalokanam, Tadvidya Achara Sevacha, Buddhimedha Kuroganaha. In this most important is Acharya Seva should be done. Acharya Seva means क्या है? कपड़ा वॉश करना, बूट पॉलिश करना. You work along with the Acharya. That is practical understanding of the theory. Practical understanding of the theory. ये क्या है practical understanding? For example, हम एक गुग्गुलू का बताता हूँ आपको. आप गुग्गुलू देते हैं. सब according to dosha you have to select. I have told you for मध्यम रोग मार्ग स्थिरा स्नायु अस्थि संधि इस रोग में गुग्गुल देते हैं. गुग्गुल बहुत गुग्गुल है. त्रिफला गुग्गुल है, कैशोर गुग्गुल है, योगराज गुग्गुल है, सिंहनाद गुग्गुल है, चंद्रप्रभा है, लक्ष्मणादि त्रयोदश गुग्गुल है. क्या गुग्गुल देते हैं? सब गुग्गुल देते हैं क्या? हाउ यू सिलेक्ट? टॉस डालते हैं. हेड है तो कैशोर गुग्गुल, टेल है तो कैशोर गुग्गुल. तब वो व्याधि कटी अस्थि संधि स्नायु को हृदय से आप गूगल देना. कौन सा गूगल है? हैं? ना क्यों देख रहे वो? दैट इज रीजनिंग शुड बी देयर यू नो. और एक बताते हैं गोक्षर गूगल बताते हैं, और एक बताते हैं चंद्रपुर बताते हैं. अब क्या रीजनिंग क्या है? हैं? अबे नहीं, अब तो हमने अभी तो बताया रक्तावरण से होता है बताया. तब क्या आवरण से हो सकता है, कफा संसर्ग हो सकता है, पित्त संसर्ग हो सकते हैं. कैसे सिलेक्ट करते हैं? रीजनिंग क्या है? उसके लिए आपको मालूम होना है उसमें क्या है. त्रिफल गुग्गुल में क्या है? हैं? त्रिफल एंड गुग्गुल हैं? पिप्पली. गोक्षर गुग्गुल में कैशोर गुग्गुल में और क्या है? त्रयोदश गुग्गुल में क्या है? हम एक बताता हम बताता एक मिनट बताता हूँ. You see, Trifala Guggulu means Trifala Pippali Guggulu. Kaishara Guggulu means Trifala Guduchi Guggulu. Gokshura Guggulu means Trifala Gokshura Guggulu. Kanchanara Guggulu means Trifala Kanchanara Guggulu. Yogara Guggulu means Trifala Chitraka Guggulu. Some other small desk. Chandraprabha means Trifala Shilajitu, Loavasma, Swarnamakshika and small other drugs. Guggulu. All Guggulus contains Trifala. Why? Trifala क्यों है भाई? सब गुग्गुलों में देखो त्रिफला है. हैं? वातावरण में बाकी ड्रग भी दे सकते हैं, इसी को क्यों? से हैं? तब आप ऐसे तो आप उसमें ओनली गुग्गुलू शोधन करके दे सकते हैं. त्रिफला क्यों मिक्स करते हैं? देखो वातरक्त अध्याय में चरा सुश्रुत में क्या बताया? टेंड you have to do Deepana Pachana Dravya. Trifala is a best Deepana Pachana Dravya. You are doing Deepana Pachana of Ama. Ama is not independent. Ama is always Vatasrupa, Pittasrupa, Kapasrupa. If a disease has Vatasrupa Ama, then use Trifala Guggulu. It contains Pippali. Pippali is Vatahara. If it is Pittasrupa Ama, use Kaishora Guggulu. Pittas Jaliyamsha more, go for Gokshura Guggulu. Kapasrupa Ama, use Yogaraj Guggulu. Kafa's Parthiv more, go for Kanchanar Guggulu. So which dosha Swarupa Ama is there? Like that you should be, Guggulu should be selected. Then comes Trayodasha Guggulu. You know what it contains? This only Guggulu, it does not contain Trifala. इसमें अश्वगंधा, बला, अजमोदा, ये सब ड्रग्स है. Equal amount of Guggulu, 50% Grita you are adding, you are making a Grita Paka. If it is Avaranat Dhatukshayat Vata Prakop hai, then you have to use त्रयोदशम गुग्गुल. आप ये पंचकर्म करने के बाद धातुक्षय वात प्रकोप बाकी है, त्रयोदश गुग्गुल. धातुक्षय वात प्रकोप है तो त्रयोदशांग गुग्गुल should be given. So I hope you understood why this can be understood. This practical understanding of theory can be done only with the Acharya Seva. Work along with the Acharya. Like that many things are there. Many things can be understood. Working around. That is for a complete understanding of a jnana, you should do work with the Acharya. So thank you very much. Next please. Thank you.
Ayurveda, it is mentioned that Anyatra Avabahuka. Anyatra Avabahuka.
Except Avabahuka.
Why it is contradictory?
Avabahuka is not Rakta Varta. Avabahuka is a actually it is nothing but there will be Bahu Kshaya, Bahu Shosha is there. Actually it is an arterial disease. If you see according to modern understanding, there will be arteries involved. That is why Avabahuka is Praspandana Hara. Whereas Vishwachi is Karma Kshaya. Karma is done by Naru. Praspandana done by artery. So Praspandana is artery dehydration. Okay, what happens this degeneration? That is nothing but Avabahuka. Actually, people usually misdiagnose Avabahuka. Vishwachi as Avabahuka and diagnose it give treatment. Actually, it is not Avabahuka. Okay? Vishwachi, radiating pain from here, here. Or nerve. If it is a nerve involved, it is treatment should be of Vishwachi. If it is a artery involved, that is nothing but Avabahuka.
Can we do Agni Karma in Avabahuka?
No. Usually another this one Asti Sanjyastigata Mata occurs on frozen shoulder. It is nothing but there we can do Agni Karma. That is Asti Sanjyastigata Mata. Even Jaloka can be also. It can use. That can be done.
Because in Avabahuka, Sirasna Yoga involvement is there.
But
the mentions
Raktamokshana is not, you should not do it. It's a degeneration tube disease. That should not be done.
Sir, as per textual reference, in Yakrut Vikara, the Siraved is advised from the Dakshina Parshva and from
left side.
what is the logic behind?
I don't know.
And in Liha Vikara, it is from the left side.
Yeah, I don't know why it is.
Probably justification.
I don't know why. Maybe. I have done Siraveda for cirrhosis of liver, all this I have done in this area.
Okay, because sir, we are.
You get a good result in that.
Yeah, we are doing a comparative study, that is the Ayurveda in non-alcoholic fatty liver disease, and one group is that is splenomegaly. Result is best as in non-alcoholic fatty liver disease in Dakshin Parshva only, not in Vama Parshva.
That I don't know. Can be done.